This is video number 4 of the respiratory system, and in this one we're really getting to the heart of how we breathe. You know that how we breathe is by generating pressure gradients, and this really gets right down to it. And so the first learning objective is describing Boyle's law and its significance in the respiratory system. Number 2, we're going to describe how we change the dimensions of the thoracic cavity, because when we change dimensions of the thoracic cavity, that's how we end up messing with Boyle's law. Or not messing with, but that's how we start seeing the application of Boyle's law. We talk about how do we get the greatest increase in volume of the thoracic cavity, and 2 different types of motions of the ribs. So Boyle's law is read out this one, P1V1 equals P2V2. Pretty straightforward and once we define things. So what is P and what is V? P means pressure, V means volume. So what this is saying is that when you have a certain pressure at a given volume, really the variable of one on the other side will be determined by the variable of the other. That seems like a very convoluted way of just explaining this. Let me look at the pictures. What we have here is a chamber. In this chamber, we have a volume of 1.0 liter. Okay, this is 1 liter. If we zoom over here, is this going to be, without looking at numbers, is this going to be more or less than 1 liter? Well, obviously it's going to be less. I smushed down the chamber. So this we're seeing at half a liter. Now, look at what's happening here. I've got, let's see, 1, 2, 3, 4, 5. I've got 5 dots. Let's call these oxygen molecules for now. Okay, let's just pretend they're oxygen molecules. So you have 1, 2, 3, 4. I've got 5 oxygen molecules living within a space of 1 liter. When that happens, this oxygen exerts a certain amount of pressure within the walls of this chamber, and that pressure happens to be 100 millimeters of mercury. How do you know that? I'm just telling you that's what it is. Okay, that's what we're going to give it to you as. That's part of the problem. Now, when you smush this chamber, what happens to pressure on the inside? If you look at it, look, I've still got, let's see, 1, 2, 3. I've still got the same number of oxygen molecules, so same amount of gas, but in an itty-bitty piece of volume, a tiny little volume. And so what happens to pressure now? Pressure goes up. Again, this is not new for you. You've seen this with the ventricular chambers as well too in the heart. And we just never explicitly said Boyle's law. So all this means to say is that if I decrease the chamber size, given the same amount of gas in there, then the pressure is going to go up. On the other hand, if I increase chamber size, given the same amount of gas, then pressure will go down. So decreasing volume increases collisions. So this is my decrease in volume. It increases collisions and thereby increases pressure. This is significant because, again, we're trying to generate pressure gradients. I'm not interested in having you guys solve anything algebraically. It's not like I'm going to give you, one pressure, one volume, and another pressure, and have you solve for the volume. That's a very simple math algebraic expression, but it's not important for what we're doing. I just need you to understand the theme that given the same amount of gas, the greater the volume, the lower the pressure. The smaller the volume, the greater the pressure. Now, this is a little fun thing to look at as well too. What we have here is, again, a handful of gas molecules in here. We don't need to bother counting them. And I'm capping this end over here. I got a plunger up top. Now what I do is that I increase the plunger. So let's just say this is, whatever volume. When I raise the plunger up, as indicated by this white arrow, I'm increasing the volume in this chamber. What happens to pressure? Pressure goes down. I have an increase in volume and a drop in pressure. Isn't that what Boyle's law tells us would happen? Absolutely, 100%. On the other hand, if I were to take this plunger and I were to smush it down, if I smush it down, given the same number of gas molecules, because I've capped this plunger, nothing can escape, I decrease the volume and I now increase the pressure within this jar, within this bottle. So now now we're going to approximate going in towards the lungs. Imagine, again, this is with a capped system here. But now what I'm going to do is I'm going to open up this cap. There's a bunch of gas floating around. In an open syringe, gas pressure and volume are at equilibrium with the environment. So whatever the gas is in here, and it's going to be the same pressure as the pressure out here. Okay? Now what I do is that when I lift up the plunger, what do I do to pressure? You know what I do to pressure. We just showed you, right? When I bring up the plunger, pressure goes down. When pressure goes down, what have I just done now? Pressure out here has been unchanged, right? Pressure here is unchanged, but now I've dropped pressure in the chamber. If I drop pressure within that chamber, which way does gas move? Gas being the red dots. Gas moves according to a pressure gradient from areas of high pressure to low pressure. Keep in mind, how did I generate this gradient? Did I increase pressure here? Or did I decrease pressure, in here, right? And that would be in this scenario. And you know the answer. I decreased pressure here. I did not mess with pressure in the environment. Look, we have no ability to mess with atmospheric pressure. We don't have that power. All we can do is mess with pressure inside our chest. So again, maybe that doesn't make sense just yet, but we'll get to it. What I want you to see, when I increase the volume, I drop the pressure, thereby inviting gas to come in. When I close the chamber, when I make the chamber smaller, I increase the pressure. When I increase the pressure, I'm inviting gas to go out, down according to its pressure gradient. Gas flows out in this case. This is how our lungs work. Now, imagine this kind of plunger and kind of jar scenario is our chest wall, our thoracic wall. This is our thoracic wall. And really what I should have done is I should have given you like one more, let's just say kind of resting state, something like that. Okay, maybe that, hopefully that's captured. Let's just say this is your resting state thoracic cavity. All right, and again, there's no real true resting state, so you really should put that in quotes because you never really stop breathing. Okay, so let's say we have something like this. What I'm really telling you then is that I can open up the plunger. Increasing the chamber size, and when I do that, pressure drops. So this is what I've done. I've opened up the plunger, so to speak, and now we got to drop the analogy. But when I open things up, I increase chamber size. When I increase chamber size, what happened to pressure on the inside here? Pressure will go down in that case. Pressure goes down. When pressure goes down, which way does gas move? Gas moves according to a pressure gradient, and it goes from out to in. And I know I still haven't explained atmospheric pressure to you. I know I'm going to get to that, right? But I just need you to see that when I increase my chest wall size, the volume, I drop pressure. Therefore, air is going to come in. When I decrease chest wall size, I increase pressure. Therefore, air is going to go out. And this is the cycle. So what I need you to see then, let me delete this resting thoracic cavity state. I just meant to show you that there's a state in between as well too. But again, you're never truly at rest. And so what I want you to see is that here, I open up my chest and I invite air to come in. Air comes in. And then when I close the chest wall, air ends up going out. And this is the cycle through which we breathe. We change the size of our thoracic cavity to promote changes to lung size because our lungs are glued to the inside of the thoracic cavity. So here, this really is the punchline. When you use your muscles to open up the chest, it drags the lungs open as well. When you drag the lungs open, pressure drops. When pressure drops, you invite air in because air moves according to a pressure gradient. On the other hand, when I squish the chest wall by just letting those muscles relax and my chest wall comes back in, then the lungs also squish just a little bit from where they were. And when the lungs squish, pressure goes up and that tells air to go out. And that's how you breathe out. This is really important. It means then we don't suck air in and push air out. We simply create environmental changes of our thoracic cavity through which air is naturally going to move according to a pressure gradient. So the next question is, how do we change dimensions of the thoracic cavity? You can imagine the thoracic cavity as this cube over here. And what I want you to imagine is that you could increase dimensions along the superior-inferior axis like this. You can increase dimension along the anterior-posterior axis, and you can increase dimensions along that lateral axis right over here. Okay. So in other words, you can lift up the top or drop out the bottom. You can move forward the front or push back the backside. You can move to the outsides, the right and left parts of the chest wall. That's what we're really talking about when we think about the superior, inferior dimensions, anterior, posterior dimensions, and lateral dimensions. So how do we do this then? Well, you got muscles that do that. What I want you to know is by far most of the volume change. It's estimated that about 70% of the volume change of the thoracic cavity happens because we drop out the bottom. The diaphragm drops down. So when the diaphragm drops down, this by far is what allows for most of the volume change in the thoracic cavity. Now, the other thing that happens is the sternocleidomastoid and the scalenes will lift the top up a bit as well too. So again, the point being that most of your volume change happens in the superior inferior dimensions. I want you to know that. Now, the anterior and posterior and lateral dimension changes happen at the same time. And this is because of rib movement. Okay, this is because of the way the ribs move. So what that means then, look, if somebody came and gave you a specific type of bear hug and they squeezed you from the right and left, what I'm telling you is when that happened, You're just stopping rib movement entirely, meaning that you're not going to see any expansion A to P either, anterior to posterior. On the other hand, if you're laying on your back and somebody sits on your chest, you're also going to restrict lateral motion. These two motions, movement of the thoracic cavity and the lateral dimensions as well as anterior posterior, are functionally tied in together through movement of the ribs, and that's because of the shape of the ribs and how the ribs end up moving. So what you'll see then, it's the same group of muscles that cause changes in the anterior posterior as well as lateral dimensions. And those are the external intercostals, a little bit of pectoralis minor, as well as serratus anterior. Okay, these are the main muscles that are going to do that. Probably the most famous one is going to be the external intercostals. These are the guys that allow for that movement of the rib. Okay, so this is looking at the diaphragm. Here's your diaphragm. It's kind of dome-like. Remember, that is the barrier between the thoracic and the abdominal cavity. So that right now the diaphragm is relaxed. When the diaphragm contracts, the diaphragm pushes down south. When that happens, the thoracic cavity volume increases because I've taken the bottom and I've dropped it down. When the diaphragm relaxes, the thoracic volume decreases. Okay, and now that forces air out. So again, one more time. When the diaphragm drops, air comes in, and that's indicated by these blue lines. When the diaphragm relaxes, now look, I'm not saying other muscles contract. I'm not saying, and when another muscle contracts, air goes out. I'm not saying that. I'm saying when the diaphragm stops contracting, when it relaxes, then air ends up going out. All right, with that in mind then, what we need to do is talk about the movement of the ribs. So here's where we're at. We looked at Boyle's law and its significance. We talked about dimension change in the thoracic cavity. The greatest increase in volume of the thoracic cavity is due to the bottom dropping out because the diaphragm contracts. Okay. The last thing is to describe this pump handle and bucket handle motion of the ribs. So let's look at that. So here are my ribs. What I want you to see is that this is a pump where you're kind of pumping it this way for water to come out. All right, so these things were named a long time ago. So this pump handle motion is going to increase anterior and posterior dimensions. And if that doesn't quite make sense, what you can imagine then is maybe drawing a line right over here. And if you were to measure that line, what are the dimensions here? Let's say this is, 5 inches. Then what we do is they say, okay, when I pump this handle out from anterior to posterior, what are my dimensions now? And obviously it's longer, right? So let's just call it 7 inches here. So whatever, these are made up numbers. So you can see that in this pump handle motion, I'm increasing anterior to posterior dimensions of this pump. What you want to notice about the ribs is that when you breathe in, there's a similar type of motion that occurs here with the ribs, and that's the whole sternum moves. Remember that the anterior attachment of the ribs is the sternum. So when this movement happens, I'm increasing A to P dimension. So if I take this and I drag it over, I'm going to say initially my A to P dimensions, anterior to posterior dimensions right there are, I'm again just making up numbers here. Let's call that 6 inches. But now when I do that pump handle motion, now my dimensions are now 9 inches. Okay? And so this is the pump handle motion of the ribs. It increases anterior to posterior dimensions. On the other hand, the bucket handle motion is this. If you look at this bucket handle, again, I'm going to do that. I'm going to draw the same types of lines that we did before. I'm going to say normally I've got between that handle and here, I'm going to call it 3 inches. But then once that pump handle motion kicks in, then what we see is now between the center of the bucket, so to speak, and the outer part now, instead of 3 inches, is now 5 inches. So I've increased lateral dimensions through this motion. Similarly, again, let's drag that over here, and let's say normally when the rib is completely resting, I'm at 6 inches, and now when I take a breath in, I got to start at the same midline point, and now the rib is going to be over here at 9 inches. Again, one more time, these are all made up numbers. Do not do not memorize those numbers. Don't memorize any percentages or anything like that. My point is, bucket handle motions increase the lateral dimensions of the ribs. Now, keep in mind, both of them happen at the same time. Again, if you were to squeeze in from the outsides, then you're going to not allow this bucket handle motion to occur, but you're also actually going to prevent the pump handle motion from occurring. If you sit on somebody's chest when they're lying down, you're obviously going to restrict A to P expansion, but you're also going to restrict lateral expansion as well. Okay? So again, the muscles that you need to know are on this slide. I won't rehash them since we already did that, but those are the muscles that you need to know. The last two slides here then are just a reminder for you, changes in anterior, posterior, superior, inferior dimensions, and is talking about some things here. Go ahead and read that on your own, freeze the video, pull up the PowerPoints. In subsequent lectures, we'll talk about this intrapulmonary pressure and some other pressure changes that occur. Okay, but these last two are basically saying the same thing. So to recap, we've covered Boyle's law. We talked about changes in the dimensions of the thoracic cavity, with the greatest change happening due to dropping out the bottom through diaphragm contraction. We described the pump handle and bucket handle motion of the ribs and how they expand anterior dimension and anterior-posterior dimensions as well as lateral dimensions. And I guess the last one we did was this: which muscles help you breathe out? Well, here's your answer. In a resting state, meaning non-exertion, non-exercise, just sitting there, at your home, just normal breathing out, you don't need muscles to help you do that. What ends up happening is this: all these muscles that open up the chest, they simply turn off. And when they turn off, everything falls back down to where it was before. So you don't need, you don't need muscles to help you breathe out. All you need is these muscles will relax. Now there's one exception. The one exception is that when you are working out or breathing out hard or blowing out hard, let's say you're blowing out a birthday candle or blowing in your dog's face, because my dog gets really annoyed when I do that. So sometimes it's fun to see when you just like blow out hard. And so when that happens, that forced expiration, not normal resting expiration, that is largely governed by the internal intercostal muscles. Okay, so the internal intercostals are there to lower the ribs, to depress the ribs, and that's going to forcefully squeeze in the ribs as opposed to letting them fall down on its own. All right, so I guess that is the last point that I want to make, and that'll wrap up this video.